Hello, Dr. James Bogash, expert in health and longevity, and revisiting the whole GLP-1 receptor agonist. It's really been pretty prevalent in the medical literature in the past couple years, even though the drug's been around since the Byetta days, so it's not that new. But what you're seeing is a lot of drug companies trying to repurpose these drugs for, it was just approved for sleep apnea. They're looking at it for heart failure. They're looking at it, in this case, for MASH, or metabolically associated steatohepatitis. Used to be called NASH, non-alcoholic steatohepatitis, but we now realize that you don't have to be, or how much the pre-diabetic and poor metabolic health play a role. And it's a pretty significant chunk of the population, but this is just the attempt to get more indications for the drugs so that maybe insurance will pay for it more and it can be a total windfall to whatever drug company happens to make them. However, when you look at some of the research on these, there are some shenanigans that get played. And all the people, you'll hear the press release, like the whole issue with cardiovascular disease. Did some of the GLP-1 receptor agonists show some improvement in cardiovascular health? Yes, it was really a pretty small percentage for the cost and the risk of side effects and the dropout rates in the studies. So this was part of the Essence trial, which has been ongoing for a while, and I believe it involves 1,200. This was looking at 800 of that group, 534 of which got the injections, 286 got placebo injections. And this is where things become important. So technically, these are still in the preprint stage. The data on this one was given at a recent conference. I wasn't able to, so there's no actual study published at this point. It's just the information given in the conference. And I wasn't able to find specifically what the placebo was. It technically should be something like saline, but maybe a little bit more viscous so that people couldn't recognize the difference. So ideally, the placebo should be an inert thing that doesn't cause any problems other than the psychology associated with it. So in this particular, and it was for semaglutide, so not any of the branded GLP-1, and these people in the study with MASH had confirmed liver fibrosis, so this is where you're starting to see some of the scarring. And the severity was level 2, level 3, so we're starting to get up to there. As you pass on to the later, like 4 or 5, I think 5 is cirrhosis, and that's not coming back. Fibrosis, there's the ability for the liver to heal itself. And so this was interim data, so they looked at week 72, so a little over, what's that, a year and 2 months, 3 months or so, 5 months, year and 5 months or so. And so the data looked pretty good, but pay attention to the placebo response in all of these. So for resolution of steatohepatitis, so the MASH went away, but there was no change in fibrosis, so pretty much they were stuck with whatever liver damage there was. It was, in the placebo group, it was 60 to almost 63% versus 34 in the placebo group. That's a pretty strong placebo response for an injection that shouldn't do anything. Improvement in fibrosis, but steatohepatitis didn't change. So kind of the opposite flip end of that. It was 37% in the drug, 22.5% in the placebo. Again, that's a pretty strong placebo response. For the resolution of steatohepatitis and fibrosis improvement, so like the whole shebang, it was almost 33% versus 16% in the placebo group. So pretty substantial placebo responses in these, but here's where things get really interesting. When they looked at adverse effects, there was 86% of the people taking semaglutide had adverse effects. Like, that's it's pretty well accepted that nausea, vomiting, diarrhea, constipation, like there's a lot of things that go along with this class of drug. It's not always that much fun to take it. But the placebo was 84% had side effects from a placebo injection. I'm not I'd really love to see more of the data. I'd really like to know what was in this placebo, because that's a really high adverse effect from a placebo. But when we get into severe adverse events, it was 13% in both the drug and the placebo. Again, that's some questionable data. Then when we look at fatal adverse effects, so people died, 0.4% in the semaglutide group. So the authors were like, hey, it's a pretty low rate of 0.4 out of 800 in there, or out of 534. Like somebody was still going to die, but it was 1.5 in the placebo group. Almost 4 times the number of fatal effects in the placebo group. I'd love if anybody happens to have some more data on this, but these numbers just don't make sense for the placebo having such a powerful effect and for it killing people more. Just the numbers aren't adding up on this. So before you run out and take your semaglutide or tirzepatide or whatever you take for NASH, maybe wait until we get a little bit closer look at the data. As always, I will post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs information, and subscribe to the channel.